brain teasers, veterinary anatomy and embryology. Important terms: aesthesiology. Aestheo means sense, so aesthesiology means logy means study. Aesthesiology, study of sensory system like eyes, ear, etc. Splank means viscera, and logy means study of viscera or study of visceral organs is splanknology. Proximal, closer to given part, usually vertebral column. More the closer to the vertebral column, more is the proximal. Proximal extremity is usually used for long bones, ossa longa, as the proximal extremity, and the extremity opposite to that of proximal extremity or the other end of the proximal extremity is the distal extremity. Proximal extremity means near to that of the vertebral column, and distal extremity means the extremity that is far away from that of the vertebral column. Volar, flexion or caudal surface of forelimbs distal to the elbow. Volar and plantar, usually volar is called to the area of metacarpals and phalanges. Volar is the part of metacarpal and phalanges, and plantar is the part of metatarsal and phalanges. So in technical term, volar is flexion or caudal surface. Caudal surface should be caudal surface, not the cranial surface of forelimb distal to elbow. Distal to elbow are the metacarpal and the phalanges. So these metatarsal and phalanges that are distal to the elbow, they are the volar, their caudal surface. And plantar is the volar is also called as palm or palmar, PALMAR, palmar. Plantar is the caudal surface of hind limbs below the hocks. Below the hock joint are the metatarsal and phalanges. So this is called as the plantar. Its caudal surface is called as plantar. Prone, position in which dorsal aspect of body is uppermost. Position in which dorsal aspect. Remember that dorsal and ventral difference between dorsal and ventral is that dorsal means near to the vertebral column. Remember that in positioning term, anatomical term, dorsal means vertebrae or near the vertebrae, and ventral means the ventricle means the clavicle region. If an organ is between the dorsal, between the vertebral column and the clavicle, so we will check that which part it is more closer to. If it is more closer to the clavicle, then it will be the more ventral, and if that part is more near to that of the vertebral column, it will be more dorsal. So vertebral column is called as towards the vertebral column is the dorsal, and towards or away the vertebral column or towards the clavicle or the sternum. More appropriate term will be sternum, towards the sternum, as they both are parallel to each other, the vertebral column and the sternum. So more near to the sternum will be the more ventral or more away from the vertebral column, and near to the vertebral column or away from the sternum will be more dorsal. So remember that and supine, position in which ventral aspect of body is the uppermost. Ventral aspect, and the prone is the position in which dorsal aspect means the vertebral column. If the vertebral column is the uppermost, as it is the normal position of the standing of cattle, buffalo, so it is the prone position. Prone position is the position of the normal standing of cattle, buffalo, sheep, goat. It is the prone position. And supine position is the position, as prone position will be that as their vertebra is on the uppermost position. Supine position in which the ventral aspect of body is uppermost. usually the cats sleep in direction in which they are and their abdomen is the uppermost, or the vertebra is touching the ground, not they and touching the ground, and they are not sleeping in on any side. If they are not sitting on any side or sleeping on any side and their vertebra is touching the ground, then it will be the supine position in which the ventral aspect of body will be the uppermost. Serum is the fluid portion of blood after clotting. Blood minus clotting protein is serum. Blood minus clotting fluid portion, not blood minus clotting protein, fluid minus clotting protein. Fluid minus clotting protein is equal to serum, and blood is equal to fluid plus cells, cellular part of the blood, and plus clotting protein. Blood is equal to cellular part plus fluid plus clotting protein, and serum is equal to the fluid minus clotting proteins, and the serum will be the clotting proteins minus the serum will be the total cellular part of the blood minus clotting proteins. Merocrine gland pass their secretion through cell wall without any loss of architecture. There are different types of glands. Holocrine gland, fully filled cells with secretory material is discharged. Callus is mass of osteoid tissue. Osteoclastoma, tumor of osteoclasts, also known as joint cell tumor. Another name of, or technical name of joint cell tumor is the osteoclastoma. Tumor of bone itself is called osteoma. Difference in osteoma and osteoclastoma: osteoclastoma is the tumor of osteocytes, cells of the bone, and tumor of the bone itself is the osteoma. Gum fossils is the articulation of teeth in their sockets in mandible and maxilla. Simply, the articulation of teeth is the gum fossils. Synostosis is the joint in which uniting medium is bone. Uniting medium is bone is called as the synostosis. Diarthrosis is freely movable joints. There are true joints. They are also called as the synovial joints, and their example is the stifle joint in the hind limbs. There its example is the stifle joint, having patella bone. Also patella bone as a sesamoid bone as at that joint. Cancellous bone. Cancellous bone is composed of plates or spicules arranged to form porous network, also known as spongy bone. The other name of spongy bone means the bones having spicules inside that, or the hollow bone having spicules is called as cancellous bone technically. Epiphysis is either extremity of bone. Will be called as the epiphysis. Remember that long bones are also denoted by extremities as the proximal extremity and distal extremity, and also as epiphysis by either extremity of bone. Endosteum is fibrous membrane that lines marrow cavity of bone. And the fibrous membrane that lines marrow cavity of bone is endosteum. Facet is flat articular surface as found between adjacent carpal bones. Fovea, small non-articular depression. It is present in many ossa longa or long bones as femur. Sesamoid bone. Sesamoid bone resembles sesame seed and are developed along the course of tendons to reduce friction. Points to sesamoid bones are less developed in humans and more developed in ruminants animals. Horses also have the well developed sesamoid bones. Points to remember: spleen is largest lymphoid organ. Ectopic heart is most common in cattle. The video of ectopic heart is also present in this YouTube channel. Patella is largest sesamoid bone in body, and patella is present on the stifle joint between femur and tibiofibula. Distal extremity of femur and proximal extremity of distal fibula has the patella, and this joint is known as stifle joint. A rod of bone can be elongated only about 1/200 parts of its length before breaking. Resistance of bone to tension is less than that of the resistance of bone to compression. So, and the units are resistance of bone to tension is 10 kg per millimeter square, and the bone can resist to compression at 16.86 kg per millimeter cube. So a bone can resist more compression than tension. Fovea capitis is found on the center of the head of femur, and horse and cattle buffalo have different shape of that fovea capitis. Tricuspid dysplasia is common in Labrador retrievers and German Shepherd dogs. Remember that tricuspid is between the right arterioverticular septa, and bicuspid valve is present between the left arterioverticular septa of the heart. In between the right atrium and ventriculum there is tricuspid valve, and in between left atrium and ventriculum there is bicuspid valve. In Epstein's anomaly, tricuspid valve is displaced toward the cardiac apex. Forestomach of ruminants consists of all of the parts except the abomasum. Abomasum is the true stomach or glandular stomach having acidic secretions. So the parts other than the abomasum as rumen reticulum and omasum are the forestomach, and hind stomach or true stomach or the glandular stomach is the abomasum. Cow, sheep, goat and humans have 32 teeth. Cat has 6 incisors. Humans, most of the animals has 4 incisors, whereas the cat has 6 incisors. Anal atresia results when dorsal membrane separating the rectum and anal fails to rupture. Galvain's groove is a longitudinal groove on upper corner incisor in horses. It is used in aging of horses. Amphiarthrosis is found in spinal column. The joint of spinal column between two vertebrae is the amphiarthrosis. Flexor muscles decrease angle between the bones as the biceps muscles of the forelimbs or human arms, and the adductor muscle move limb towards the median plane. Flexor muscle decrease the angle between bones. Adductor muscle move limb towards the median plane. Pectinus muscle in inguinal region is an adductor muscle. Gluteal muscle is an abductor muscle. Gluteus maximus is also on the hind limb of human, and it is one of the largest muscles of humans, and it is an abductor muscle. Tendons are fibrous tissue connective bones to the muscle. Tendons, the difference between tendon and ligaments is that tendons are fibrous and they connect bones to muscle, and ligaments connects bone to bone. Ligaments connect bone to bone and tendon connects bone to muscle. Cardiac muscles is striated with centrally located nuclei. Rigor mortis is absent in smooth muscle. So and no one checks the smooth muscle as lungs, liver, spleen, pancreas. For rigor mortis, everyone checks the rigor mortis within the skeletal muscles mostly, as the bicuspid valve, biceps etc. Study of visceral organs related structures is known as splagnology. Splang mean visceralogy means study of viscera is or visceral organs is the splanknology. Body of hazel are found in thymic medulla. Hazel bodies or body of hazel are found in thymic medulla. Bursa of Fabricius, lymphoid organ of poultry and poultry epithelium, outgrowth of cloaca. The outgrowth of cloaca, this organ as the lymphoid organ, as the bursa of Fabricius. Bursa of Fabricius in actual is the outgrowth of cloaca. Testes, ovaries, pancreas have both endocrine and exocrine function. Pituitary gland is located at base of brain and sella tarsica of sphenoid bone. Sickle shaped kidney is found in horse. Os penis bone is found in penis of dog and cat. Not sure for cat. Penis of horse is literally compressed. Literally compressed penis is in horse. Rumen extends from diaphragm to transverse of tuber cocci. Trachea extends from cricoid cartilage of larynx to roof of lung. Spermatic cord consists of 7 things: artery, vein, vessels, artery or vein combined called as the vessels, lymphatic, nerve, vessels, nerves, lymphatics, muscle, tunica vaginalis and ductus deferens. And their technical, if we remember with their technical names, then it will be the testicular artery and vein, testicular artery, testicular vein, lymphatics and testicular plexus of nerve, internal cremaster muscle, a muscle that is internal cremaster muscle, tunica vaginalis and ductus deferens. So we can remember in simply as it has an artery, a vein, a nerve, lymphatic, a muscle, tunica vaginalis and ductus deferens. Thyroid follicles are found by a single layer of cuboid epithelium. Bull and ram have helmet-shaped glands called as Galli glandis. Glans is spirally twisted anti-clockwise in boar. Sigmoid flexor is not present in stallion, horses, humans, etc. Bony pelvis consists of sacrum, coccygeal vertebrae and cocci. 2 vertebrae as the sacrum, sacral vertebrae, coccygeal vertebrae and 1 os cocci. Os cocci is made up of 3 bones, ilium, ischium and pubis, and os cocci plus 2 vertebrae at sacrum and coccygeal vertebrae makes the bony pelvis. Neck of uterus is known as cervix. Neck of uterus is known as cervix. Neck of most of the organs is known as cervix. Cervix is the technical name for cervix. Fornix is the angle formed by a cervical projection into vagina. Heart extends from 3 to 6th ribs in ox. Spines are found in tomcat's penis. Axial skeleton consists of all of these as ribs, sternum, vertebral column, brain, head or skull. Os penis is found in dog. Snout of pig consists of os rostri. Os cordis is present in heart of dog. Elastic cartilage is found in external ear. Reproduction is not intended to be the function of skeleton. Parietal layer of Bowman's capsule is made up of simple squamous epithelium. Simple squamous epithelium also lines the capillaries of the circulatory system. Simple cuboidal epithelium is present in oviduct. Gastrointestinal tract, excretory ducts of gland, gallbladder are made up of simple columnar epithelium. Gallbladder is made up of simple columnar epithelium, and the urinary bladder is made up of transitional epithelium. Do not confuse gallbladder with urinary bladder epithelium. Gastrointestinal tract, excretory ducts of gland and gallbladder are made of simple columnar epithelium. Means that the intestine, digestive system, excretory system and the gallbladder are made up of simple columnar epithelium, and circulatory system is made up of simple simple squamous epithelium. Squamous epithelium lines the circulatory system as the capillaries and vessels, whereas the columnar epithelium lines the digestive and excretory system as gastrointestinal tract, excretory ducts of gland and gallbladder. Which one supports the head? Ligament nuchae supports the head, nuchae or nuchae. Ligament nuchae supports the head. Choose the elastic connective tissue. Ligament flava is a elastic connective tissue. Which cartilage is located in intervertebral disc? Intervertebral disc has fibrocartilage. Choose the exocrine gland. Liver is exocrine gland. Which of the following is a ductless gland? All of above are ductless gland or endocrine gland. Endocrine glands are also known are ductless glands, and they are adrenal gland, thyroid gland and pituitary gland, whereas the exocrine gland has ducts. Whereas the exocrine glands has ducts, as liver has duct, and the ductless glands or endocrine, remember, endocrine ductless. So the ductless glands or endocrine glands are the pituitary gland, adrenal gland, thyroid gland. Choose the right answer. Epithelium is for protection. Epithelium protects. Muscular tissue contracts. Nervous tissue conducts. Nervous tissue conducts. Muscle contracts. Epithelium protects. And blood is for circulation. Choose the right sequence. Right sequence is cell, tissue, organ, body. Cell, tissue, organ, body. Which one is not a characteristics of living cell? All of the above is not characteristics of living cell, as the all of above according to this book. A cell is not irritated, it do not move, it do not reproduce according to this book. Match the following. The squamous cells are in kidney, as the excretory system is made up of mostly squamous cells. Cuboidal cells are in thyroid. Thyroid gland has cuboidal cells. Kidney has squamous cells, and endothelium has endothelium linings are of blood vessel. Blood vessels has endothelium, and columnar epithelium is in digestive system. Digestive system and urinary system mostly have columnar epithelium, whereas the kidney has squamous epithelium. Simple squamous epithelium. Other squamous epithelium is also in the circulatory system, blood vessels or the capillaries. Cuboidal epithelium is in thyroid gland. Thyroid gland has cuboidal cells. Endothelial lining is of blood vessels, and it is endothelial lining is the simple squamous epithelium that is also present in kidney. The type of articulation present in spinal cord is amphiarthrosis. Amphiarthrosis is in spinal cord. Articulation of spinal cord. Spinal cord articulates as amphiarthrosis. Arthrology is the study of joints. Myology is the study of muscles. Splanchnology is the study of viscera, and aesthesiology is the study of sense organs. Striated muscle with centrally located nuclei is characteristic of muscle found in heart. The muscle of heart are striated and they have centrally located nuclei. Striated and central nucleus. Fetal median ligament. Fetal median ligament of the bladder contains both 1 and 3 as uricus and umbilical arteries. Umbilical arteries and uricus are present in the fetal median ligament of the Bladder has a ligament as fetal median ligament, and this ligament has urachus and umbilical arteries. In fetus, yolk sac is attached to small intestine. In fetus, yolk sac is attached to small intestine, and this regressed part can also be pointed on postmortem examination of the bird. So in small intestine has the attachment with yolk sac. Extra or abdominal part of gubernaculum forms ligament of tail of epididymis. Extra abdominal part of gubernaculum forms ligament of tail of epididymis. Mullerian duct forms cervix and vagina. Cervix and vagina originates from Mullerian duct, and extra abdominal part of gubernaculum forms ligament of tail of epididymis. Occipital myotomes are origin of muscle of tongue. Occipital myotomes are the origin of muscles of tongue. Mullerian duct forms cervix and vagina. Extra-abdominal part of gubernaculum forms ligament of tail of epididymis. Paramesonephric duct is also known as Mullerian duct. Paramesonephric duct is also known as the Mullerian duct, and uh, that Mullerian duct forms cervix and vagina. Mullerian duct forms cervix and vagina, and this Mullerian duct is also known as the paramesonephric duct. Occipital myotomes are origin of muscles of tongue. Urogenital sinus gives rise to vagina. Urogenital sinus give rise to vagina, and vagina is also originated from paramesonephric duct or Mullerian duct, and it also gives, and the urogenital sinus and paramesonephric duct or Mullerian duct, they give rise to vagina. Bones having alveoli for teeth development in ruminants are maxilla and mandible. Maxilla and mandibular bones have alveoli for teeth development in ruminants. Surface of teeth frequently used to determine age in ruminants is occlusal. Occlusal or occlusal or occlusal teeth are used to determine age in ruminants, and maxilla and mandible bones have alveoli for teeth development in ruminants. Blood vessel supplying the teeth of lower dental arcade in ruminants is inferior alveolar artery. Inferior alveolar artery supplies the blood to the teeth of lower dental arcade. And occlusal surface of the teeth frequently used. Occlusal teeth are used for age determination, and maxilla and mandible are the bones having the alveoli in ruminants. Nerve supplying the teeth of upper dental arcade in ruminants is infraorbital artery. Infraorbital nerve supplies the teeth to upper dental arcade, and inferior alveolar artery supplies the blood to lower dental arcade. Remember that inferior to lower in vessels and inferior to upper teeth as nerves. The inferior orbital nerve. Orbital inferior, it means that is below the orbital fossa, and it supplies the innervation to upper dental arcade, whereas the inferior alveolar artery provides the blood supply to lower dental arcade. In ruminants, alveolar nerve supplies to lower dental arcade. In ruminants, alveolar nerves supplies to lower dental arcade, and this lower dental arcade is supplied blood through the inferior alveolar artery. and this and alveolar nerve supplies to lower dental arcade. Which one is present in ox but absent in sheep? Spheroid sinus is present in ox but absent in sheep. Sheep do not have spheroid sinus, but ox has spheroid sinus. And alveolar nerve supplies to lower dental arcade. Nerve supplying the teeth of upper dental arcade in ruminants is infraorbital, and the vessel that supplies blood to lower dental arcade is inferior alveolar artery. Alveolar nerve, there are two questions related to nerve, that inferior orbital nerve supplies to upper dental arcade and lower dental arcade is supplied with alveolar nerve. Upper dental arcade with infraorbital nerve and lower dental arcade with alveolar nerves. There are two nerves that are innervates the dental cavity. If it is upper dental arcade, then there should be infraorbital nerve. If there is lower dental arcade, then there should be alveolar nerve. Upper dental arcade is supplied with nerve innervations of infraorbital nerve, and the lower dental arcade is innervated by the alveolar nerve. Which one is present in spheroid sinus is present in ox but absent in sheep. Major nerve supplied to bovine horn is derived from cornual nerve. Horn is itself as a cornual process, so its nerve is the cornual nerve. Major nerve during supplied to bovine horn is derived from cornual nerve. Cornual artery is a branch of superficial temporal artery. The artery that is near or that supplies to temporal bone, and its branch or division of as a superficial temporal artery. It supplies blood to cornual artery, and it's not the cornual artery. There is cornual nerve, but there is no cornual artery. Cornual process is supplied with innervations by cornual nerve, but this blood supply is by superficial temporal artery. In oxen, anesthetic for Peterson's eye block is deposited around orbitorotundum foramen. Orbitorotundum foramen is the place where an ox anesthetic for Peterson's eye block is deposited. It can be for enucleation or any other surgical procedure for eye, but for Peterson's eye block, target is the orbitorotundum foramen as anesthetic deposition place. Which one is present in ox but absent in sheep and goat? Ox has facial artery, but it is not in sheep and goat. There is also a spheroid sinus that was present in ox but absent in sheep. And there are two differential points in ox and sheep, that ox is blessed with spheroid sinus, and the other thing is the facial artery, whereas sheep do not have spheroid sinus, sheep do not have facial artery. Spheroid sinus and facial artery are present in ox, but the spheroid sinus and facial artery are not present in sheep. Or in other words, ox has spheroid sinus and facial cavity, whereas sheep do not have spheroid sinus and facial cavity. Prepared site for thoracocentesis in oxen is 6th to 7th intercostal space. Between the 6th to 7th intercostal means intervertebral space. It is the prepared site for thoracocentesis. Thoracocentesis for Oxen is 6th to 7th intercostal space. Widest, most accessible ribs for bone marrow aspiration are 6 to 8th ribs. 6 to 8 ribs same approximately to that for thoracocentesis. It is the same as it is the widest and most accessible ribs for bone marrow aspiration. The site for bone marrow aspiration and thoracocentesis is the same, but it is limited to 6 to 7th in thoracocentesis, whereas it is 6 to 8 in bone marrow aspiration. And the ox is blessed with facial artery and another is spheroid sinus, whereas the ox do not have spheroid sinus and facial artery, or the spheroid sinus and facial artery are present in ox but spheroid sinus and facial artery are absent in sheep, whereas goat only do not have the facial artery. Widest and more accessible 6th to 7th intercostal spaces are the space for thoracocentesis and bone marrow aspiration, whereas we can also take the bone marrow aspiration from 7th to 8th ribs. Which one does not form a part of forestomach? Abomasum is not a part of forestomach, as it is a true stomach or glandular stomach. Which one is true or glandular stomach in ruminants? Reticulum, abomasum, they all are the four stomachs. They are not true stomach or glandular stomach. Most cranial cardiac valve in ruminants is pulmonary valve. Pulmonary valve is the most cranial cardiac valve in ruminants. Which one does not form part of forestomach? Abomasum do not form the part of forestomach. And the which one is true or glandular stomach? Abomasum is, or the stomach is the true stomach. All of above as reticulum and abomasum are the part of forestomach and they are not the true stomach. Most cranial cardiac valve in ruminants is pulmonary valve. Pulmonary valve is the most cranial cardiac valve. Longest artery that supplies the distal regions of pelvic limb of ruminants arises from, or the largest artery is the femoral artery, and this femoral artery supplies the distal regions of pelvic limbs of ruminants. Hard Milker condition involves papillary duct. Papillary duct causes the hard Milker condition involves papillary duct. Largest artery is femoral artery and most cranial valve is the pulmonary valve. Abomasum is true stomach and 6 to 7 or 8 ribs are the ribs area for thoracocentesis and bone marrow aspiration, and facial artery is present in ox but it is absent in sheep and goat, and orbito-rotundum foramen is the target site for anesthesia in Peterson's eye block. Choose the least accurate statement. All are correct, as a hilus is present in all ruminants' kidney. All the kidneys of ruminants have hilus. And renal calyces are absent in ox. Ox do not have renal calyces. External contour of kidney is smooth in all ruminants. External contour of kidney is smooth in all ruminants, and the kidney of cattle, buffalo are lobular. There are lobes on the kidney. Renal pelvis is absent in ox, sheep and goat. It is wrong. Renal pelvis is present in ox, sheep and goat. Hilus is also present in kidney in ruminants, as the renal pelvis, hilus and renal calyces are present in ox. External contour kidney is smooth in all ruminants. During semen ejaculation and urination, which muscle is most helpful? Urethralis muscle, or the muscle of urethra, is important during semen ejaculation and urination. And other for amputation of cow udder. For amputation of cow udder, the nerve is anesthetized as L1 and L2. L1 and L2 nerve block is for amputation of cow's udder. Urethralis muscle is important during semen ejaculation and urination. Hilus, renal pelvis, renal calyces are present in kidney of all ruminants, and external contour of kidney is smooth in all ruminants. Urethralis muscle is for semen ejaculation and urination. L1 and L2 nerve block is for the amputation of cow's udder. Which one is absent in swine liver? The liver of pigs do not have a papillary process of caudate lobe and caudate ligament. In liver, swines do not have papillary process of caudate lobe. Swine liver have caudate lobe, but swine liver do not have papillary process of caudate lobe, and it do not have caudate ligament. Papillary process of caudate lobe and caudate ligament are absent in liver of swine. Teeth is used as defensive weapons in boar or canines. Canines are used as defensive weapon in canines. Which one is absent in pigs? Palatine tonsil is absent in pigs. Pigs do not have palatine tonsil. Canine teeth are used for defense in pigs. And which hepatic ligament is absent in pigs? Caudate ligament is the hepatic ligament that is absent in pigs. And another was the papillary process of caudate lobe and caudate ligament. This question is repeated as it is saying that caudate ligament is absent in pigs, and it also do not have the papillary process of caudate lobe along with caudate ligament in liver of pigs. And which one is not a natural orifice in wall of abdomen? Epiploic foramen. Epiploic foramen is not a natural orifice in wall of abdomen. Epiploic foramen is not a natural orifice in wall of abdomen. Caudate ligament is absent in pigs. Palatine tonsil is absent in pigs. Pigs do not have palatine tonsil, caudate ligament, and teeth are used in pigs as weapon of defense. And the other things that are absent are papillary process of caudate lobe and caudate ligament. They are also absent in pigs. L1 L2 nerve block is for amputation of cow udder, and during semen ejaculation and urination urethralis muscle is involved, and the hilus, renal pelvis, and renal calyces are present in kidneys of ruminants, and external contour of kidney is smooth in all ruminants. In summary, the kidney of ruminants have hilus, renal pelvis, and renal calyces. And the external contour of kidney is smooth in all ruminants. I am not sure about that because the kidney is lobular in cattle buffalo. During semen ejaculation and urination urethralis muscle is involved. L1 L2 nerve is involved, blocked for amputation of cow's udder. And which one is absent in liver? Papillary process of caudate lobe and caudate ligament are absent in swine liver, and canines are teeth of defense in boars. And which one? Palatine tonsil is absent in pigs. Caudate ligament is also absent in pigs, and epiploic foramen is not a natural orifice in wall of abdomen. Which one does not act by binding calcium? Heparin do not bind calcium. Which one does not act by binding calcium? Heparin do not bind calcium. Heparin accelerates the activity of antithrombin 3. Heparin is anticoagulant and it accelerates antithrombin 3 decomoral toxicosis, affects clotting factor 2, 7, 9, 10 because of inhibition of vitamin K. Vitamin K is blocked in decomoral toxicosis that affects clotting factors 2, 7, 9 and 10. Heparin accelerates activity of antithrombin 3 and heparin does not act by binding calcium. Heparin do not bind calcium. Antithrombin 3 heparin accelerates the activity of antithrombin 3. Decomoral toxicosis affects the clotting factor 2, 6, 2, 7, 9, 10 because of inhibition of vitamin K. Red blood cell with no central pillar and much smaller than normal are spherocytes. Spherocytes are red blood cells with no central pillar and much smaller than normal. Spherocytes are red blood cells that are smaller in size and they are not pillar centrally. Red blood cells are the cells that spherocytes are the red blood cells that are normal and smaller than normal size and they have no central pillar. Decomoral toxicosis affects factor 2, 7, 9, 10 because of inhibition of vitamin K. Heparin accelerates the activity of antithrombin 3 and this not acts by binding. Heparin do not binds calcium. Immunoglobulin producing cells are plasma cells. Plasma cells are produced by immunoglobulins. Plasma cells give rise to immunoglobulin. Plasma cells differentiates into immunoglobulins as Ig, GAMDE. 5 types of immunoglobulins. Eosinophilic inclusion body normally present in lymphoid cells of guinea pigs is Karloff body. Karloff body is the eosinophilic inclusion body that is normal present in lymphoid cells of guinea pigs. Plasma cells give rise to immunoglobulins. Spherocytes are the smaller and no central pillar red blood cells. Karloff body are the eosinophilic inclusion body normally present in lymphoid cells of guinea pigs. Karloff body are the eosinophilic inclusion bodies. Schistocyte is which one is a red blood cell fragment? Schistocyte is a fragment of red blood cell. Schistocyte is a fragment of red blood cell. Immunoglobulin filled vacuole in cytoplasm of plasma cell is Russell body. Russell body is the immunoglobulin filled vacuole in cytoplasm of plasma cell. If the cytoplasm of plasma cells has immunoglobulin filled vacuole, there is a plasma cell and it has a vacuole and the vacuole has immunoglobulin in plasma cell, then this plasma cell will be called as a Russell body. Russell body is a plasma cell whose cytoplasm has a vacuole having immunoglobulin. And schistocyte is a fragment of a red blood cell. Karloff body is eosinophilic inclusion body that normally present in lymphoid cells of guinea pigs. It is mostly reported in guinea pigs and it is the eosinophilic inclusion body of lymphoid cells. It's Karloff body. Plasma cell give rise to immunoglobulins. Spherocytes are smaller in size red blood cells and they have no central pillar. Vitamin K is inhibited by decomoral toxicosis and it infects clotting factor 2, 7, 9 and 10. And lymphocytes. Leukocytes predominant in peripheral blood of adult cow and weaning pig are lymphocytes. Lymphocytes are the predominant leukocytes that are predominant in peripheral blood of adult cow and weaning pig, or in summary, lymphocytes are the predominant leukocytes in of the peripheral blood. And in summary, choose the least accurate statement. Hilus is present in all ruminant kidneys. Renal pelvis is also present. Renal calyces are also present in all ruminants, but renal calyces are present in ox. External contour of kidney is smooth in all ruminants. During sperm ejaculation and urination, urethralis muscle is involved. L1 L2 nerve block is for amputation of cow udder. Which one is you absent in swine liver? Swine liver do not have papillary process of caudate lobe and caudate ligament. Teeth used as defective weapon in boar is canines, and palatine tonsil is absent in pigs. Caudate ligament is also absent in pigs, and epiploic foramen is not a natural orifice in wall of abdomen. Epiploic foramen is not a natural foramen in in abdomen. In wall is not a natural orifice in wall of abdomen. Which one does not? Heparin does not binds calcium. Heparin antithrombin 3. Heparin accelerates antithrombin 3. Decumoral toxicosis inhibits vitamin K that affects factor 2, 7, 9 and 10. Red blood cell with no central pillar and much smaller are the spherocytes. Spherocytes are smaller in size red blood cells with no central pillar. Immunoglobulin cells producing plasma cells give rise to immunoglobulins. Curl of body are the eosinophilic inclusion body that normally present in lymphoid cells. Schistocyte is a fragment of red blood cell. Russell body. Russell body is a plasma cell whose cytoplasm has vacuole that is filled with immunoglobulin. It's the Russell body of the type of plasma cells, and the predominant leukocytes in peripheral blood are the lymphocytes. Choose the correct answer. Nuclear remnants of red blood cells are Howell Jolly body. Howell Jolly body are the nuclear remnants of red blood cells. Lead poisoning is known as plumbism, or plumbism is the lead poisoning. PB is the abbreviation of lead, so PB from PB plumbism is lead poisoning. Production site of blood coagulation proteins is liver. Liver produces blood coagulation proteins. Plumbism is lead poisoning. Howell Jolly body is the nuclear remnant of red blood cells, and precursor of beta lymphocytes are plasma cells. Plasma cells are the precursor of beta lymphocytes, also the precursor of immunoglobulins. Plasma cells produce immunoglobulins that are of 5 types GAMDE, and they are also plasma cells are also the precursor of beta lymphocytes. Howell Jolly body are the nuclear remnants of red blood cells. Plumbism is the lead poisoning. Plasma cells are precursor of beta lymphocytes, and liver produces the site of blood coagulation proteins. Babesiosis in cattle causes intravascular hemolysis, and the major cross match and minor cross match. Remember that if I am a donor and I am donating a blood to someone and my cells are being tested, so it will be the major cross match. That cells are, if I am the donor and my cells are being tested, it is major test cross. Always consider the cells whose cells are being considered. Do not consider plasma. Consider the plasma is opposite to that of the donor cells. The plasma relation is opposite to that of donor cells. Cells are oppositely related with plasma, and it means that if cells are of donor, then the plasma will be of the recipient. So as we are considering that as for example I am the donor and my cells are being tested, so it will be the major cross match. So from this example we are saying that test cross using plasma and recipient cells, my cells are not being considered as I am the donor, so If my cells are being considered, then it will be major cross match. So as I am the donor and my cells are not being considered, so it will be the minor cross match. Marginal bodies are in plasma, so it's also species anaplasma marginale. So as it has the marginal bodies in the cells within the cell, and plasma is present within the cells, and it has this it is diagnosed as it is present in margins of the cell. So it's the species anaplasma marginal, and it is on marginal bodies. Poor source of iron is milk, so milk is fortified with iron by many firms. So milk is poor source of iron. Test using recipients plasma and donor cells. As I am the donor in an example, and I am donating the cells, and my cells are being tested, so it will be the major cross match. So from that we had studied that whole jolly bodies are the nuclear remnants of red blood cell plumpism. Lead is lead poisoning. Plasma cell is precursor of beta lymphocytes and antibodies. Liver is the production site of blood coagulation proteins. Babesiosis in cattle causes intravascular hemolysis. Test using the, if the donor cells are being tested, then it will be the major cross match. If donor cells are not being tested, then it will be the minor cross match. Marginal bodies are in anaplasma marginal has marginal bodies, and milk is poor source of iron. Free nuclei from metarubricides are hematogenous. Free nuclei from metarubricides is hematogenous. Mucus casts formed in small bronchioles is Cushman's disease. Cushman spirals is mucus casts form in small bronchioles, and hematogenous is the free nuclei from metarubricides. And Cushman's spirals are the mucus casts found in small bronchioles. Lung, respiratory system having the bronchioles, small bronchioles. If having the mucus casts, mucus in small bronchioles is caused as the Cushman's spirals. Whereas hematogenous free nuclei from metarubricides are free, have free nuclei, are do not have nuclei, then it is hematogenous. Basophilic nuclear debris in macrophages has tringible bodies. Tringible bodies are the basophilic nuclear debris in macrophage. If a macrophage has a basophilic nuclear debris, macrophage having the nuclear debris that is basophilic, then it will be the tringible bodies. And if the metarubricides do not have nuclei, then it will be the hematogenous. And bronchioles having mucus is the Cushman's spirals. Elongated double pyramidal structure formed by coalescence of eosinophilic granules. The structure that is elongated double pyramidal shaped structure is formed by coalescence of eosinophilic granules is the karyote or Legden cells. Legden cells are or karyote are the elongated double pyramidal structure formed by a coalescence of eosinophilic granules. Bronchioles having mucus. This is the Cushman spirals, and the metarubricides that do not have nuclei. The hematogenous and tringible bodies are the basophilic nucleus debris in macrophage. Macrophage is having the nucleus debris that is basophilic is the tringible bodies. Karyote or legend crystals are the elongated pyramidal shape like structure that are formed by coalescence of eosinophilic granules. If the eosinophilic granules are coalesced and they make shaped pyramidal like elongated double pyramidal like, then it is the karyote or legend cells. So karyote or legend cells in summary are the coalescence of eosinophilic granules. Linear distribution of cells seen On pull, sum of fluids of high viscosity is known as a wind drawing. Wind drawing is the linear distribution of cells seen on pull. Sum of fluids of high viscosity. High viscous fluids, if they make this linear distribution of cells, then it is the wind drawing. And karyote or legend cells are the coalescence of eosinophilic granules. Tringible bodies are the basophilic nuclear debris in macrophage. Macrophage is having the basophilic debris, or macrophage having the nuclear debris is the tringible bodies. And Crushman spirals are the mucus cast in small bronchioles. And metarubricides do not, if the metarubricides do not have the free nuclei, then it will be the hematogenous. Babesiosis in cattle causes intravascular hemolysis. Test used the recipient donor cells. Donor cells, as if I am donor and I am giving cells, and or my cells are being tested, then it will be the major test. Cross milk is poor source of iron. Marginal bodies are in anaplasma. So our anaplasma marginally is a species. Nuclear remnants of red blood cells are in whole jolly body. Whole jolly body type of red blood cells have nuclear remnant of red blood cells. Lead poisoning is plumbism production site of red blood cells. Red blood coagulating proteins are liver. Liver produces blood clotting proteins as well, and precursor of beta lymphocytes and immunoglobulins is the plasma cells. And wind drawing is the linear distribution of cells seen on pulling some of the fluids of high viscosity. High viscous fluids that results the linear distribution of cells is a wind drawing. Smallest erythrocytes are present in goats. Goats have smallest size of erythrocytes. Choose the only source of endogenous heparin. Basophil and mast cells are the only source of endogenous heparin. Goat have smallest sized erythrocytes. Plasma protein of large animals used to detect internal inflammatory lesion is fibrinogen. Fibrinogen is a plasma protein, or fibrinogen detects internal inflammatory lesions, or fibrinogen can be used to detect inflammation. Internal inflammation is detected by a fibrinogen. Basophil and mast cells are endogenous source of heparin, or basophil and mast cells produce heparin. Smallest red blood cells are in a goat. And plasma protein of large animals used to detect fibrin is fibrinogen. Fibrinogen is a plasma protein that can be used to detect inflammatory lesions. Which of the following cannot be counted with hemocytometer? Reticulocytes cannot be found with hemocytometer. Species with natural sickle cell red blood cells is deer. Deer has naturally sickle celled red blood cells, and reticulocytes cannot be counted by hemocytometer or Neubauer chamber. Fibrinogen is the used to detect internal inflammatory lesions. And basophil and mast cells produces endogenous heparin. Goats have smallest red blood cells. Deer has sickle celled red blood cells. Iron supplement is specially required by pigs. Pigs require iron supplementation. Deer has sickle celled red blood cells. Reticulocytes cannot be counted by Neubauer chamber or hemocytometer. And fibrinogen can be used to detect internal inflammation. Match the following. Scutiform cartilage is in ear muscles. Ear muscles have scutiform cartilage. And auditory ossicles. C is in middle ear. Middle ear has auditory ossicles. And scutiform cartilage is in ear muscles. Auditiform ossicles are in middle ear. Malleus bone is hammer shaped. Malleus, three bones, incus, malleus, and stipes is third, I think. Auditory ossicles are in middle ear. Scutiform cartilage in ear muscles. Auditory ossicles in middle ear. Malleus bone is anvil. Malleus bone is hammer shaped. Incus is anvil shaped. Incus anvil shaped. malleus is hammer-shaped. Auditory ossicles are in middle ear. Scutiform cartilage is in ear muscles. So we had studied that the nuclear remnants of red blood cells are in whole body. Lead poisoning is plumbism. Liver produces is the production site of blood coagulating proteins. Plasma cells are the precursor of beta lymphocyte and immunoglobulins. Babesiosis in cattle causes intravascular hemolysis. Test using the donor's cells is the major test. Cross milk is poor source of iron. Anaplasma has the marginal bodies. Free nuclei from metaerythrocytes is hematogenous. If metaerythrocytes do not have free nuclei, then it is hematogenous. Mucus cast in small bronchioles of the bronchioles has mucus cast, and it is Crushman's spirals. Basophil nuclear debris in macrophage. If the macrophages has the debris that is basophilic nuclear, then it is stringible bodies. Stringible bodies are actually macrophages that has nuclear debris. Karyoid or legend cells are the elongated double pyramidal structure formed by if the carrion or legend cells are the coalescence of eosinophilic granules. Coalescence of eosinophilic granules is known as karyoid or legend cells. Stringer bodies are the macrophages that have nuclear debris. Hematogenous is the metaerythrocytes that are free from nuclei, and Crushman spirals are the small bronchioles having mucus casts. Linear distribution of cells seen on pull due to viscosity is withdrawing, and smallest erythrocytes are present in goats. Mast and basophil cells produce endogenous heparin. Fibrinogen can be used as a detector of internal inflammatory lesions. Reticulocytes are not detected, cannot be counted by hemocytometer. Deer cells has sickle cell. Red blood cells pig requires to be supplied with iron. Scutiform cartilage is in ear muscles. Auditory ossicles are in middle ear. Scutiform cartilage are in ear muscles. Auditory ossicles is in middle ear. Malleus bone is hammer shaped. Incus is anvil shaped. Incus anvil shaped. Malleus hammer shaped. Auditory ossicles in middle ear. Scutiform cartilage in ear muscles. Match the following. Cerebral aqueduct. Cerebral aqueduct is aqueduct of sylvius and cerebral peduncles. Olfactor bulbs are in quadrigeminal bodies. Olfactor bulbs are quadrigeminal bodies, and corpora quadrigemina is telencephalon. Corpora quadrigemina telencephalon. Olfactory bulb in quadrigeminal bodies. Corpora quadrigemina telencephalon. Corpora quadrigemina telencephalon. Olfactor bulbs are in quadrigeminal bodies. Crura cerebri. Crura cerebri is also in telencephalon. Crura cerebri and corpora quadrigemina are in telencephalon. Telencephalon has crura cerebri and corpora quadrigemina. Telencephalon has crura cerebri and corpora quadrigemina. Telencephalon has two as the crura cerebri and corpora quadrigemina, whereas the quadrigemina bodies are the olfactor bulbs. And cerebral aqueduct has cerebral peduncles and aqueduct of sylvius. Aqueduct of sylvius and cerebral peduncles are in cerebral aqueduct. Cerebral aqueduct is linked with cerebral peduncles and aqueduct of sylvius. Cerebral aqueduct of sylvius and cerebral peduncles, whereas crura cerebri and corpora quadrigemina are linked with telencephalon, and olfactor bulbs are linked with quadrigeminal bodies. Incus is anvil shaped. Malleus is hammer shaped. Auditory ossicles are in middle ear. Scutiform cartilage is in ear muscles. Pigs are supplemented with iron. Veter-Pacinian corpuscles are in subcutaneous connective tissue. Veter-Pacinian corpuscles, subcutaneous connective tissue. Proprioception. Proprioception is of muscle cells, is muscle sense. Muscle sense is proprioception, and subcutaneous connective tissue has vater, pacinian, corpuscles. Falx cerebri or falx cerebri is in a sickle-shaped fold. Sickle-shaped fold, falx cerebri, and subcutaneous connective tissue has vater, pacinian, corpuscles. Proprioception is muscle sense. Pons are in metencephalon. Pons are in metencephalon. Falx cerebri is sickle-shaped fold. Pons in metencephalon. Falx cerebri is sickle-shaped fold. Proprioception is muscle sense, and vater, pacinian, corpuscles are subcutaneous connective tissue. Proprioception muscle sense. Falx cerebri sickle-shaped fold. Pons are in metencephalon. And the true points are: the fourth ventricle is located between cerebellum above the pons and medulla below, or the fourth ventricle is present between cerebellum and medulla. Cerebellum, fourth ventricle, and medulla. Or other words, fourth ventricle is located between cerebellum above and pons and medulla below. Cerebrum and medulla, fourth ventricle, cerebrum and pons, fourth ventricle, and medulla. Hydrocephalus means water in heart. It is false. Hydrocephalus means water in brain. And Habencular nuclei is found in epithalamus. Epithalamus has habencular nuclei. Habencular nuclei is found in epithalamus. Fourth ventricle is located between cerebellum above and pons below. And tuber cinerum attaches pituitary gland to brain. Tuber cinerum attaches pituitary gland to brain, or pituitary gland, tuber cinerum, and then brain. And habencular nuclei is found in epithalamus. Tuber cinerum attaches pituitary gland to brain. Fourth ventricle is between cerebellum, pons, and medulla. Vater, pacinian, corpuscles are subcutaneous connective tissue. Proprioception is muscle sense. Falx cerebri is a sickle-shaped fold. Pons are in metencephalon. Falx cerebri is single-shaped fold. Proprioception is muscle sense, and fourth ventricle is between cerebellum, pons, and medulla. And tuber cinerum attaches pituitary gland to brain. Habencular nuclei is found in epithalamus. Basal nuclei represent gray matter of corpus striatum. Basal nuclei represent gray matter of corpus striatum. Corpus striatum has gray matter that represents basal nuclei. Tuber cinerum attaches pituitary gland to brain. Vater, pacinian, corpuscles are subcutaneous connective tissue, and muscle sense is proprioception. Sweating is parasympathetic activity of sweat gland. It is false. Parasympathetic drugs are used as laxatives or cathartics. Parasympathetic drugs are used as laxatives or cathartics. Chorda tympani is responsible for taste sensation. Taste sensation is by chorda tympani, and chorda tympani is a branch of facial nerve. Chorda tympani is a branch of facial nerve that is responsible for taste sensation. And base of tongue is sensitive to bitter taste. Bitter taste is detected by base of tongue. and parasympathetic drugs are used as laxative and cathartics. Lateral side of tongue is sensitive to sour and salt. Tip of tongue is sensitive to bitter taste, only it is false. So the lateral side of tongue is sensitive to sour and salt, and bitter taste is on base of tongue. Base of tongue sensitivity is for bitter taste. Lateral side of tongue is sensitivity for sour and salt. And chorda tympani is responsible for taste sensation, that is, and chorda tympani is the branch of facial nerve. Parasympathetic drugs are responsible are used as laxatives and cathartics. Basal nuclei represents gray matter of corpus luteum. Tuber cinererum attaches pituitary gland to brain, and central area of retinae contains only cones. Cones are present only in the central area of retina. And nictitating membrane is a cartilage. The composition of nictitating membrane is as cartilage. Central area of retina contains only cones. Lateral side of tongue is sensitive to sour and salt, and base of tongue is sensitive to bitter taste. Chorda tympani is a branch of facial nerve which is responsible for taste sensation. Parasympathetic drugs are used as laxatives and cathartics. Basal nuclei represents gray matter of corpus striatum. Tuber cinerum attaches pituitary gland to brain. Pituitary gland is attached to brain by tuber cinererum, and fourth ventricle is between cerebellum, pons, and medulla, and pons are in metencephalon. Muscle sense is proprioception. Falx cerebri is sickle shaped fold, and veter-pexinian corpuscles are in subcutaneous connective tissue. Nictitating membrane is a cartilage. Articular cartilage is a hyaline cartilage. Articular cartilage is hyaline cartilage, and nictitating membrane is also a cartilage. Diaphysis is a cylindrical shaft of long bone. The shaft of ossa longa or long bone is called as diaphysis. It is cylindrical in shape. Diaphysis is shaft of cylindrical vein or bone or ossa longa. The short bones are known as ossa brevia. Articular cartilage is a hyaline cartilage. Scrotum is located behind the inguinal canal in dog. Scrotum is behind inguinal in dog. Globular scrotum is found in bull. Bull has globular scrotum, and scrotum is located behind inguina in dog. Diaphysis is cylindrical shaft of long bone. Articular cartilage is hyaline. Hyaline is an articular cartilage. Elliptical scrotum is found in where globular scrotum is not the shape of bull. Bull do not have globular scrotum, but the boar has elliptical scrotum. Right kidney is more cranial than left kidney, so mostly the left side kidney is palpated, as we palpate by left hand, so left side by left hand is able to palpate the kidney, as it is more caudal. The more caudal, the easily to palpate. It is difficult to palpate the right kidney as it is more cranial. And the articular cartilage is hyaline cartilage. Diaphysis is cylindrical shape shaft of bone. Elliptical scrotum is found in boar. Veter-pexinian corpuscles are in subcutaneous connective tissue. Proprioception is muscle sense. Falx cerebri is sickle shaped folds. Pons are in metcephalon. Fourth ventricle is between cerebellum, pons, and medulla. Hydrocephalus dura mater is loose fibrous. It is also found. Habencular nuclei is found in epithalamus. Epithalamus has habencular nuclei. Tuber cinererum attaches pituitary gland to brain. Brain is attached with pituitary gland through tuber cinererum. Basal nuclei represents gray matter of corpus striatum. Parasympathetic drugs are used as laxatives or cathartics. Chorda tympani is responsible for taste sensation and it is the branch of facial nerve. And chorda tympani tastes base of tongue is sensitive to bitter taste. Base of tongue is sensitive to bitter taste and the taste is detected through the chorda tympani, that is the branch of facial nerve. And lateral side of tongue is sensitive to sour and salt taste, that is through the chorda tympani, that is branch of facial nerve. Central area of retina contains only cones. Nictitating membrane is cartilage. Cartilage is a nictitating membrane.